In this video, we will do an exam review of toxic shock syndrome. Few important exam questions before we do the topic and then get the answers after the topic is done. Question number 1. Which staphylococcal disorders are due to toxin production? Number 2. What type of toxins staph produces? Number 3. What are the skin features in toxic shock syndrome? Number 4. Which organism's toxin causes toxic shock syndrome? Number 5. What substances are released in cytokine storm? Number 6. Where endotoxin is produced in toxic shock syndrome? And number 7. What's the advantage of using clindamycin for toxic shock syndrome? Now let's do the toxic shock syndrome. Toxic shock syndrome is a suddenly developing potentially fatal illness caused by Staphylococcal aureus, Streptococcus pyogenes, and Clostridium sororelli. The condition develops in those who lack a protective antitoxin antibody, which Staphylococci and Streptococci toxin produces toxic shock syndrome. Staph toxic shock syndrome is produced by enterotoxin and or by a toxin resembling enterotoxin, a pyrogenic toxin superantigen 1. Number 2. Strep pyogen toxic shock syndrome is produced by its exotoxin. Streptococcal M-type are associated with invasive group A streptococcal infections and toxic shock syndrome. M protein is the major virulence factor of group A streptococcal infection and is resistant to phagocytosis and multiply rapidly in the blood. So how the toxin act? Toxic shock syndrome toxins act as T cell mitogen. Activated T cell cause cytokine storm, causing the release of inflammatory cells and interferon, interleukin 1 and interleukin 6 and TNF alpha, tumor necrosis factor alpha and TNF beta. Cytokine release causes vasodilation, disseminated intravascular coagulation, myocardial suppression, renal failure, acute respiratory distress syndrome, and multi-organ failure. The multi-system organ disorder resembles endotoxin shock. Endotoxin produced by GIT enhances the effects of toxic shock syndrome. So GIT producing endotoxin in toxic shock syndrome. How staph and strep toxic shock syndrome occurs? Staphylococcal toxic shock syndrome may be caused by the use of number 1. Highly absorbable tampons that cause toxic shock syndrome on the second or third day after the start of menstruation, or number 2. Toxic shock syndrome may be non-tampon in origin. The non-tampon type TSS is due to skin infections and is caused by enterotoxin, whereas the tampon type is caused by the superantigen type 1 toxin. So non-tampon type staphylococcal TSS is caused by enterotoxin and the tampon type is caused by superantigen 1 toxin, whereas streptococcal toxic shock syndrome is often associated with skin and soft tissue infections like cellulitis, necrotizing fasciitis, myositis, bacteremia, and gangrene, but it doesn't occur with streptococcal throat infection. So streptococcal throat infection does not cause toxic shock syndrome, whereas it is caused by skin and soft tissue infections. Now the clinical features of toxic shock syndrome: high fever of 102 degree Fahrenheit, hypertension of 90 millimeters of mercury. So hyperthermia with hypotension, diarrhea, vomiting and disorientation, and generalized edema and acute respiratory distress syndrome. There is hyperemia of the mucous membrane, and staph TSS there is diffuse macular rash, whereas streptococcal toxic shock syndrome lacks rash or has a generalized erythematous rash. The rash in both cases is followed by desquamation in the convalescent period about 1 to 2 weeks after the onset of illness. So desquamation in the convalescent period 1 to 2 weeks after the onset of the illness. Streptococcal toxic shock syndrome has bacteremia and is associated with soft tissue infection. Now the lab findings in toxic shock syndrome. The X-ray chest feature. pulmonary infiltrates, pleural effusions, and the features of acute respiratory distress syndrome. In the blood, there is hypoxemia and leukocytosis with thrombocytopenia and a platelet count of less than 100,000 per micron liter. There is coagulopathy, disseminated intravascular coagulation, low fibrinogen and fibrinogen degradation products. The Clostridium sordelli toxic shock syndrome causes a WBC count of 50,000 to 200,000 per micron liter. The condition is rapidly progressive and may be fatal. The features of liver: serum bilirubin more than twice the normal with hypoalbuminemia, and in the kidney, serum creatinine is more than twice the normal. So serum bilirubin and serum creatinine more than twice the normal in toxic shock syndrome. And polymerase chain reaction (PCR) assay for rapid testing of staphylococci. Isolation of organisms from sterile site, that is CSF and blood, or from the non-sterile site, that is skin and sputum. Treatment of toxic shock syndrome. For staphylococcal and staph pyogenes TSS, clindamycin 600 to 900 mg IV 3 or 4 times a day. And number 2, a combination therapy of clindamycin with penicillin. Necrotic tissues be removed by debridement as occur in necrotizing fasciitis. And for Clostridium sordelli TSS, ciprofloxacin 400 to 600 mg IV 3 or 4 times a day. IV immunoglobulins in the toxic shock syndrome are also used. They neutralize the toxins. And for penicillin allergy, what drugs are used? Metronidazole 500 mg IV 6 hourly plus ciprofloxacin 400 to 600 mg IV 3 times a day. So what's the mortality rate in toxic shock syndrome? With Staph aureus, it's less than 5%, but with streptococcal pyogenes, it's more than 25%. Now, answers to the questions. Which staphylococcal disorders are due to toxin production? The 3 disorders which are due to toxin productions are food intoxication, toxic shock syndrome, and scalded skin syndrome. Question number 2. What type of toxins staph produces? It produces 3 types of toxins. Exfoliating, that causes scalded skin syndrome. Number 2, cytotoxin, and number 3, enterotoxin and or a related pyrogenic toxin superantigen 1. Question number 3, what are the skin features in toxic shock syndrome? In staphylococcal toxic shock syndrome, there is a diffuse macular rash, whereas streptococcal toxic shock syndrome lacks a rash or has a generalized erythematous rash. The rash in both cases is followed by desquamation in the convalescent period 1 to 2 weeks after the onset of the illness. Question number 4. Which organism's toxin causes toxic shock syndrome? Staphylococcus aureus, Strep pyogen, and Clostridium sordelli. Question number 5. What substances are released by cytokine storm? Cytokine storm producing interferon, interleukin 1, interleukin 6, tumor necrosis factor alpha, and tumor necrosis factor beta. Question number 6. Where endotoxin is produced in toxic shock syndrome? Endotoxin in toxic shock syndrome is produced in the GIT. It acts as a synergistic for the other toxin produced by the toxic shock syndrome, so it enhances the effects of toxic shock syndrome. Question number 7. What's the advantage of using clindamycin for toxic shock syndrome? It is a protein synthesis inhibitor, so it inhibits the toxin production by different bacteria. Question number 8. How Clostridium sordelli causes toxic shock syndrome? Endometrial clostridial infection, particularly with Clostridium sordelli, rapidly progresses to toxic shock syndrome and death with a WBC count of 50,000 to 200,000 per micron liters.